program called Moderate Alzheimer's Disease, Maintaining Connections. You will have the opportunity to submit text questions to today's presenter by typing in your questions into the questions pane of the control panel. You may send your questions in at any time during the presentation. I'll be collecting them, and we will address those during the Q&A session at the end of today's presentation. We are unable to take live questions from those of you who are exclusively on the phone. However, we've provided contact information at the end of the presentation that you can use if you have concerns that need to be addressed. As a reminder, we won't be able to answer person-specific medical questions, so we're asking you to keep your questions general and really topic-focused. It's my pleasure to introduce to you our speaker for today's session. Heather Mulder is the Outreach Program Manager at Banner Alzheimer's Institute, where she assists in the creation and delivery of a variety of education and support programs for people with dementia and family caregivers. Welcome, Heather.
Thank you, Lori, for the warm welcome, and welcome to all of our attendees today. This topic, I think, is an especially important one, maintaining connections, especially now as someone has progressed more to the moderate stage of the disease. To go over a little bit of a roadmap of what we're going to discuss today, first, I think it's important that we understand the importance of staying connected as the disease progresses. Sometimes we can get more focused on the task at hand, and activities and things that bring pleasure can kind of start to fall by the wayside. So we're going to have a little discussion about that. Then we'll talk about strategies to modify activities to meet current abilities. It's really important to keep in mind that I can't even think of an activity that I've run across that you are not able to modify in some way so that your person can still experience activities that have always brought them joy, but just now in a way that meets their current ability levels. Then we'll talk about some options for support and some strategies for success. So let's just jump right in and talk about, let's talk about why activities. Oh, there we go. So activities define who we are as individuals. And so you can reflect on things that you do throughout your day, things that provide meaning, things that enhance your quality of life. You can see how they really do illustrate who you are. They're showing that you are a parent, or you are a spouse, or you are a child, or you are a caregiver, or you are someone who enjoys being creative. Whatever the case may be, what we choose to do with our free time really is an indicator of who we are as an individual. And the thing that really changes for people with Alzheimer's disease in the early stage, and even as they progress more to the moderate stage, is they're going to be less able to engage on their own in these activities. And so it's really important that we do help them to still participate in things that bring them joy, again, provide that meaning, enhance their quality of life. When I speak of activities today, I want you to really have a broad picture of what activities really do incorporate, because I think sometimes when I use that term, people immediately jump to the big events that we do in our life. So we're going out to dinner, we go to a movie, something like that. Activities in the context of what we're talking about today incorporates everything we do on a daily basis. So consider household chores, personal care activities. So we also call these the activities of daily living. Quiet activities, also the more active activities, and then it does include social activities as well. So a very broad view of what activities are. And it's really important to try to keep engaging your person in all of these activities. You can see just even running through the list how important they are to define who we are, as I've said before. So even things like household chores. I mean, honestly, I think if we had someone who came to us and said, you know what, just take a break, you don't need to clean, you don't need to cook, I've got this taken care of for you, we probably all would celebrate for a little bit of time, I would say a couple weeks, maybe even a month, we would be like, yes, this is fantastic. But probably after a month or so of someone doing absolutely everything for us in the household, all of a sudden we're going to kind of start to lose our place. We're going to lose our sense of belonging and our sense of meaning in this household structure. And so we start to kind of lose our connection to that role that we were filling. So understand that all of these different types of activities are things that we can use to fill our person's day. And this is across the entire course of Alzheimer's disease. But the moderate stage, I think, is especially difficult because we're constantly talking about the importance of staying engaged, but then also the difficulty of it. And you know what? I mean this not just for your person, I mean this for you as well. If you attend a lot of classes like this, you probably are very familiar with people saying the importance of maintaining connections, of filling their days with purposeful activities, of staying engaged. But the real challenge becomes, because of the nature of this disease, as someone has now progressed to the moderate stage, it's much more challenging for them to be able to engage in activities. They're going to have more difficulty initiating things that they didn't have trouble with in the past. Or maybe in the early stage you were just offering gentle reminders for them to go and do different things. Now that they're more to the moderate stage, we're looking at more hands-on assistance. So your load and your stress is getting to be much more. And that's when we look at the person with dementia. We also do want to talk about the importance of staying engaged for you as the caregiver. And just for the reason that I talked about earlier, that your person's needs are getting greater and greater as this disease progresses, it becomes more and more difficult for you to find time or to make it a priority to engage in activities that fill these other roles other than caregiver. And so both of these pressures put on top of each other can start to add to a lot of stress that's now getting added to your plate. You know, it almost reminds me of a frog in a boiling pot type situation, where early on we're the frog and we're hanging out in the pot and it's really quite comfortable. But now the pot's getting warmer and warmer and things are getting hotter, and so a lot more stress gets added to the situation. But it's so subtle that we don't necessarily pick up on the fact that that's happening. It's almost once we get to a breaking point, once we get to some sort of crisis moment where we realize, wow, I'm so stressed out, I'm so overwhelmed right now. So I do want to talk about some ways to adapt activities for a person. I mentioned earlier that I don't think that I've run across an activity that we can't adapt in some way, so that something that a person enjoyed prior to developing dementia is something that they can do in early stage and be adapted again for moderate stage and be adapted again for late stage. Speaking of the moderate stage, I have on this slide, there's really 3 ways that you want to look at adapting activities, and they are time, participation, and senses. And these will all, consider these when you're looking at an activity for your person, and these will all be adapted for each of the different stages and even within the stage. Your person may be able to do something yesterday, but they're not able to do it today. So you'll need to adapt again. But really consider, when you're scheduling activities, how can you adapt for time, for participation, and for their senses. And so for time, generally speaking, someone in the moderate stage is going to need shortened activities. And generally about 30 to a maximum of 60 minutes is going to be all that they can handle for most of the types of activities. Also really do consider, what is your person's best time of day when scheduling activities. Most people have ebbs and flows in their energy levels throughout the course of the day. And they can be pretty predictable. For example, I am a morning person. My alarm goes off and I'm just up and out of bed and I am ready to go. I know that there are many people out there who are not morning people. So if I develop dementia, knowing that I can wake up and just go, we need to schedule things for me in the morning. So think about, how does your person function best and what time of day do they function best? If they are generally really sharp and on their game at 10 o'clock in the morning, that is when you schedule going to the doctor's appointments. That's when you schedule doing something, playing a round of golf with friends, and those sorts of things that are going to require a lot of energy on their part. And I don't necessarily mean physical energy. Think about the mental energy that's having to go into activities as well. So even sitting in a group of people that you've known for a long time and going out to lunch, that can be very taxing for someone with Alzheimer's, simply because of all of the superfluous noise that's happening around them. All of the information that they're having to process at once is going to be very taxing for them. So know their best time of day and schedule accordingly, and then also really do try to manage fatigue for them. Now that your person has progressed to the moderate stage, they're going to need more rest than they had in the past, and they're also going to be less able to express to you that they're getting fatigued. It would really be ideal if our person could just come to us and say, oh my gosh, what a great time I had going bowling with the grandkids. I'm really pooped. I think I'm going to lay down and get some rest. More than likely, your person is not going to be able to do that for us, and so it's up to us to really monitor when they're getting fatigued. So if you start to see someone getting more anxious, getting more confused, maybe getting a little agitated, these are your nonverbal indicators that your person is potentially getting overwhelmed or fatigued. And it's time to then prompt them to do something, do a quiet activity. Oh, let's go and sit down and watch the birds in the backyard, or why don't we go sit in the comfy recliner and just take a rest for a little bit. We also can modify activities for participation. And a lot of times people do, when they think of participating in activities, the only thing that we think about is fully engaging, fully participating in an activity. And we need to realize that full participation isn't necessarily going to happen for every activity, especially now that someone's in the moderate stage. So know that even, for example, going to the park and watching children play on a playground, that can still be engaging in an activity when they're not playing on the playground. So along those lines, too, we're probably going to need to engage our person rather than invite them. So in early stage, maybe we were able to say, hey, it's time to go do this, or come do this with me. And now we're going to need to do a lot more prompting, a lot more cueing, get everything ready to go to complete the task at hand. Another good strategy that we can use for participation is to break the activity into steps or simplify the activity for them. A lot of times when we expect our person to do something or we ask them to engage in something, let's do something like some of these daily living tasks. We think that we're just asking them to do one task. Hey, we're going to leave to go to the store. Why don't you go brush your teeth before we go? And we think we've just asked for one thing. We've asked them to brush their teeth. And the reality is we've asked them to do many, many little things that lead to getting the teeth brushed. And so if you find that you're giving this end product statement to your person, why don't you go brush your teeth, and you don't see it getting initiated, try breaking it down. Come on with me and go into the bathroom. Open the medicine cabinet. So you grab your toothbrush right there. It's purple, and you can even use gestures to try to enhance the meaning because your person now in the moderate stage is going to have more difficulty understanding verbal communication. So always try to enhance your message with your nonverbals as well. But break these things down into little teeny tiny steps, and you're in a way kind of coaching your person through these tasks. And especially for things like these activities of daily living, these are so important for us to try to break them down so that our person can still do them. I think we can all agree, especially with activities of daily living, we would much rather do them ourselves than have someone step in and do them for us. I would much rather bathe myself than have someone bathe me. Brush my teeth, groom myself, all of those sorts of things, and that doesn't change just because someone develops Alzheimer's disease or just because they progress into the moderate stage of Alzheimer's disease. So while task breakdown can be more time-consuming, it's really a gift of dignity and a gift of quality of life that we're giving them by doing that. And then finally, with participation, I mentioned this just a moment ago, the importance of your nonverbal communication. Also along those lines, being mindful of what you are saying verbally. Really do pare down the amount of words that you're using when you communicate in general, but in particular with activities too. And we may need to provide hand-over-hand assistance for our person. And earlier on in the moderate stage, it may not literally be hand-over-hand. We could do mirroring. Maybe your person isn't eating the food on their plate, and we've tried, oh, this is your favorite meal. We've tried a lot of different prompts to try to get them to eat. Potentially sitting right next to them and eating right next to them seeing you do it can help bring those connections together and help them figure out how to actually eat the meal. Finally, we can adapt activities for senses. And in the moderate stage, keep in mind that stimulating the senses can enhance and detract from an activity. So we always want to monitor that our person is not getting overwhelmed by sensory stimulation, but we can also use it to enhance things that we're doing as well. So the smell of fresh laundered linen and those sorts of things can really enhance an activity that we're doing with them. Whereas if we have too much stimulation, that can become very overwhelming too. So a lot of times we give all of these great strategies for how to adapt activities, but then when it really comes to the practical application, it can be a bit of a stretch to figure out how to do it. So I have a couple examples on here that I wanted to go over for how you would modify an activity for someone who's in the moderate stage. So our first example on here, I did a personal care activity, and it was getting dressed in the morning. So with time, I didn't really think we should set an exact minute timeline, but getting dressed is either something we want to look towards the best time of day or something that we're going to work into their routine. So I would say, generally speaking, most of us are going to dress first thing in the morning, and then we're going to dress in the evening when we change into our pajamas. There probably isn't going to be a lot of flexibility there. With participation, in the moderate stage, they may start to fixate on certain clothing. And so you can find them wearing the same outfit over and over and over again, and no matter how many times you show them incredible other options that look so nice on them, they still want to stick with that one same outfit. Know that this is very common for people in the moderate stage of Alzheimer's. And so what we can do then to work with where they are is to buy multiples of the exact same outfit. So if we know that they love the red shirt with the blue jeans, go back out and get 4 or 5 outfits that are the exact same. And then what you can do is when they're in the shower or they're bathing, just kind of sneak in the bathroom, switch out the dirty clothes and replace it with the clean ones. And that can be a good strategy, because I know a lot of caregivers do struggle with someone who wants to wear the same thing every day. At a certain point, you really do need to try to get them into something different. Another thing that we can do in the moderate stage is get rid of any unnecessary or unworn clothing. So maybe the fancy dress that we wore to the Christmas party 10 years ago doesn't need to be in the closet anymore. Even think of seasonally adapting the wardrobe. So pull out the sweaters if it's not sweater weather. Keep only what are good, viable options for that person to wear right front and center for them. You want them to feel successful if they're going into the closet or opening the drawers and picking things out. So only give them options that will be the correct answer. We may need to cue them in selecting clothing or even offer choices. So they may not still be able to walk into the closet and pick out an outfit, or that could be very overwhelming for someone in the moderate stage. So another way to adapt is to pull out 2 different outfits and say, which one of these would you like to wear? And let them choose. Also, they may need assistance with what order to put the clothing on and with certain types of fasteners. So another way you could adapt is by not getting the button-down shirts anymore that his fingers aren't quite able to manage anymore. Maybe we're getting shirts with snaps, or we're getting shirts that just pull over the head instead. Also, assistance with order. I had a caregiver who was talking about how she was adapting for her husband throughout the course of the disease when he was dressing. And she said, you know, she started out just holding up a couple outfits, and then that kind of became overwhelming for him. So she started laying the clothes out for him. That worked really well for a while, but then she said she learned the hard way that she needed to lay them out in the order they get put on, because one day he came out with his underwear on top of his pants. And then she said she also learned that she needed to not lay her clothing out at the same time too, because he ended up coming out in her outfit one day. So some of these lessons, we learn them on the fly. But know that these are good ways to adapt so that our person can remain as independent as possible when they're dressing. Now with sensory, again in the moderate stage, know that it can be overwhelming or it can enhance what we're doing. Now in the moderate stage, they're probably going to have an impaired sense of smell. And so if we have someone who is now fixated on a certain outfit, who continues to wear it day after day after day, and the moderate stage is also where you can see a lot of resistance to bathing. So they may not recognize that the clothing is soiled. They may not recognize that it has an odor or that it is mismatched at this point too. So let's look at another example. And this is for a more active activity. We picked going out to dinner. And now in the moderate stage, something like going out to dinner is going to be very stimulating for your person for the most part. So for time, we thought probably up to an hour would be the maximum. This, because there is so much stimulation that happens with going out to eat, you're really going to want to schedule this during their best time of day or off hours at the restaurant. So we're not going to the new place that just opened up downtown on Friday night at 6 o'clock. Look at modifying either where you're going, what time you're going there, those sorts of things. Also consider if it is going to be a busier time, making a reservation so that you don't get there and then have to wait for an extended period of time, because that's going to be taxing on your person as well. To modify for participation, have your person sit by someone who will keep them engaged. You can develop a sort of buddy system for this. This is really important because it gives them a chance to interact with someone else where maybe that's been a struggle in the moderate stage or even in the earlier stages too. Talk to the person ahead of time and say, can you just keep them engaged in conversation, help them select what they want to order, those sorts of things. This is a great task for that person who's come to you and said, hey, anything at all I can do for you. I'd be happy to help out, just let me know what it is. This is a perfect assignment for them. It gives your person a break from you, and it gives you a break from your person as well. Another way to adapt for participation, sometimes menus can be overwhelming to me. I think especially of places like the Cheesecake Factory that has like a spiral-bound book of selections. That's overwhelming to people who are cognitively normal. So think about, is there a picture menu that they could offer instead, or instead of having them flip through the menu, Offer them two things. Oh, you know what? You've always loved the spaghetti here, and you just mentioned you had a taste for a hamburger. Which one would you prefer? Instead of having them potentially get overwhelmed by the menu. You can also adapt by removing any unneeded utensils. So more than likely, we're not going to need 3 different spoons and 2 types of forks and a couple different knives to navigate our meal. So just get rid of the ones that aren't necessary. This eliminates the risk of them trying to use the wrong utensil or use it inappropriately. And then cue them as needed. And I mentioned earlier, even just sometimes sitting next to them and eating next to them can be a visual cue. For sensory adaptations, know that going out to eat is going to be very, very stimulating for your person across the board. So really do keep an eye and make sure that they're not getting overstimulated. And know that some signs for that could be an uptick in confusion, maybe they're getting a little more agitated, those sorts of things. Now, when engaging a person with dementia, I mentioned it's important for them to stay socially connected. Know that crowds, even in the early stage, can start to become overwhelming for someone. Especially now in the moderate stage, there's so much information, so much sensory information that's needing to be processed to help you navigate in a large group of people, that this can become overwhelming for someone in the moderate stage. So one-on-one may become the best way to interact with your person. You also want to simplify conversations. Again, not using unnecessary words and unnecessary topics. And then also share best strategies for success. If you are the primary caregiver, no one knows your person better than you. And if we're trying to keep them socially connected with people, I think what's challenging a lot of times is when someone, especially now, progresses to the moderate stage, people don't know as well how to interact with them. And sometimes it's easier for them to kind of turn a blind eye to it, or you start to lose social connections that you had in the past. And if you're working to keep your person engaged with people who they've been friends with or interacted with for potentially years and years of their lives, you really need to share the strategies that you have learned so that everybody can have a positive experience. I do want to spend a few minutes talking about the importance of you yourself staying engaged. And I put this image up of the airplane with the oxygen mask coming down because Lisa Gibbons actually, in a book for caregiving, talked about this concept of taking the oxygen first. So if you have ever been on a plane, the stewardesses are going through the pre-flight instructions, and then they come to, should the cabin lose pressure, the oxygen mask will drop from the ceiling. If you are traveling with a child or someone else who is vulnerable, put your oxygen on first. And we don't normally think twice about a statement like that, but it's so very important. And the reason they have you do this is because if you're not getting oxygen, if you are not going to be able to take care of the person who needs you. So I think our natural instincts as caregiver is to take care of our person. And that's what we've become so focused on. Oxygen and activities that have meaning for us help us stay engaged with who we are, help us stay centered, helps us rejuvenate ourselves, and then be able to come back to our person refreshed and ready to be the best caregiver we can possibly be. I hear a lot of different excuses from caregivers about why they have lost this personal time or a sense of need for personal time. And there are a few themes that kind of come forward. The first one is guilt. You've been taking on so much in your role as caregiver that sometimes we can start to think that we're the only person that can do this. Or we start to think that this is our sole purpose is to spend 24 hours a day caring for our person. And if we take time away from our person, or we try to have someone else come in or hire a professional, whatever the case may be, we start to feel guilty about it. The second reason that caregivers cite for not staying engaged is time, which is such an interesting set of opposites in a way. It's almost like, do we have too much time or too little time? A lot of times in the moderate stage, you can find yourself making both those sorts of statements. So I find caregivers start to get really overwhelmed in the moderate stage trying to fill their person's day with activities. I mean, the day can seem endless when you look at it. And in that view, time is massive. But then when we turn it around and we say, you need to take time and do things for yourself, then all of a sudden we have a totally different attitude about how much time we have, and we say we absolutely don't have enough. So I would ask you to consider if you still have a hold of yourself now that you're a caregiver of someone in moderate stage. When we talked about the importance of engaging in activities earlier on in this session, we talked about all these different roles that we play in our life. You know, we are spouse, we are parents, we are child, we are friend, we are neighbor. We're a lot of different things. And when we take on caregiver early on, it's something that's in addition to all of our other roles. And then as our person's needs get greater and greater and greater and more time consuming, many of these other roles kind of start to fall off. And then the only role that we can identify with is that of caregiver. So it's really important that we do take a step back and take some time for ourselves and reconnect with these other roles that we've maybe pushed to the side. Know that it is okay to reach out for help. Caring for someone with Alzheimer's disease cannot be done with one person. So it is okay to reach out for help from other friends, family members, and other services. And I want to take some time to discuss some of the options for care. So the first way that you can look at getting care for your person is through informal resources. And informal resources would be more family members, friends, acquaintances, people who you run into, say, at your church or at the bridge club, those sorts of more kind of casual acquaintances, as well as family, neighbors, friends, all fit into kind of informal caregivers. Advice for that, first of all, don't be afraid to ask. As we like to give to other people like to give to us too, and so we need to allow them the ability to do that and the joy that it brings from being able to help out another person. So think about those people who make those helpful statements. Anything you need help with, just ask. Just ask them. They're telling you that because they want to help you. Consider your needs when you're thinking about your informal care as well. What do you really need help with? Do you just need help keeping up with day-to-day living? Could you maybe hand off running errands? Could you hand off transportation to a doctor's appointment or transportation to the barber shop or something like that? Another need could be you just need a break or some alone time. You know, I worked with a family a few years ago who, it was a wife who was caring for her husband who lived in the home with her, and he was to the point where he really wasn't safe by himself anymore. And even just kind of leaving the room and not laying eyes on him, she didn't feel comfortable doing anymore. And one of her friends, she asked her to come over once a week for just a couple hours and spend some time with her husband. And she went and took a bubble bath. She didn't even leave the house, but she was able to go and take some alone time, relax, release some tension, and she knew her husband was safe. He was with her friend. If she was needed, her friend would come and get her. And she said that was the greatest gift she could have gotten from her friend. So know that you needing to take a break or have some alone time is perfectly okay. Or do you need some help doing tasks or assisting with tasks? Think about also What are some things that you hate doing? Are there some tasks that you really dread? And could you get those off of your plate? So do you hate mowing the lawn? Is there someone in the neighborhood who could mow the lawn for you? So maybe this is an opportunity to clear your plate of things that really cause you more stress than it's worth doing. And then take stock of your resources. So think of who are these friends, family members, neighbors, who could potentially help out informally for you. Looking at needs and resources, think about who goes to the same places you do. Do you always run into your neighbor at the grocery store, at the local Walgreens? Well, that means they go there, so just hand them your shopping list and see if they're able to pick up a few things for you. Think about who is close to your person and could they keep them engaged in social events. So another family that I've worked with, it's the husband who's caring for his wife, and he's been very open with her friends about what is happening with her and really adamant that they stay engaged with her. He calls them her angels, and they take her out to eat once a week. They take her to different activities. So through communicating with them and pretty much being adamant that they're going to be a part of her life, she's been able to maintain these social connections well into the moderate stage. And then again, what would you like to take off your plate? So do you hate taking care of the lawn? Do you hate grocery shopping? Ask someone else to take care of that for you. And don't eliminate people from your potential helper list just because they live out of town. People out of town can be really valuable in doing, say, research. Maybe they could help you with bill paying, those sorts of things. So think about tasks that you don't necessarily need someone physically close to do something, but that would really help you out. So ensuring success, we really do need to be mindful what we communicate with people. We want everybody, our person, we want these informal caregivers who are coming in to be successful because we want this to maintain and our person to be able to continue to have these connections. So give them the information they need to be successful. I mentioned earlier, you know your person best. What strategies works for you? So an example that maybe you've just noticed when you're out and about, well, mom starts digging through her purse, that's really her nonverbal cue to you that she's ready to go. She's had enough of this. Share that with the person who's interacting with them. Let them know he becomes overwhelmed with the full menu, so just give him a couple options. Or if your person can get disoriented easily, let them know. She can get lost easily, so make sure you stay with her when she goes to the bathroom. Those sorts of little tidbits that you have learned along the way. Notice that you don't have to disclose every detail of their diagnosis or treatment with other people for them to be able to interact successfully with them. Now, when we look at more formal care, in-home care can be a good option. And there's informal in-home care, which could be found through family, friends, volunteer agencies. Sometimes churches do have like a volunteer network that can be really helpful. So look into those sorts of options. But then there's also a more formal option in a home care agency that you could bring in. Home care agencies provide both medical and non-medical services. So this can be nice if maybe you're not at the point where you're needing more hands-on help. You could start to bring in one of these home care agencies in a non-medical capacity. That could be through friendly visits. That could be through engaging your person in activities, errands, chores, those sorts of things. And that gets your person used to having someone come around and interact with them. And that way then, if you transition to needing more medical care, they're more comfortable with it. Medical care can include intermittent care under Medicare. And for that, to be able to tap into that benefit, you're going to need a physician order and a skilled need. They also can come to help deliver medication, provide hands-on care, and even potentially physical therapy. So when looking at a home care agency, many times this is the first time we have tried to hire someone to care for someone else. And so I wanted to discuss some of the pros and cons of using a formal agency versus using an informal type of caregiver, that friends and family type of thing. So for an agency, a pro is that the employees are already screened or bonded. So someone has taken care of looking at this person, doing a background check, and kind of checking all the boxes to make sure that they're a good fit for this agency. With informal care, that would be a con, is because when you're calling someone in who's not part of an agency, you're exclusively doing the screening. With an agency, another pro is that you're hiring a team. That's a pro because they come with the same philosophy. They have all experienced the same training. Hiring a team is also a con because you may not get the same staff person each time. And so you may find one staff person interacts really well with your person while another one maybe not so much. For informal care, you're hiring an individual, and this is a pro because you know who you're getting. Every single time it's going to be the same person walking in the door. That is also a con because if that person happens to get sick or need time off, you're going to have to go through the hiring process again to find someone to replace them. And then also, a pro for agency would be a varied payment source, so you can private pay for most of these home care agencies. You can also potentially tap into long-term care insurance or the Medicare benefit, as I mentioned earlier. The average cost is $23 to $25 an hour. For informal care, you may get a little bit of a savings with informal care. And a con side of that is that informal caregivers, you can only pay them privately. So you're not going to be able to tap into any insurance that you have if you're hiring an informal caregiver. On this slide, I hope this will be helpful for you when considering which care agency to hire or which individual to hire. There's a lot of questions that you need to think through to find the right fit for your person. So the first thing I would encourage you to ask about is training. Have they received specialized Alzheimer's or dementia training, and are they also trained or certified in first aid and CPR? You also want to know what this organization or what this individual will specifically do for you. So will they do activities with your person? And who's in charge of doing these? Are you creating a list of activities, or are they going to come with them? Are you providing all the supplies, or are they going to bring some for you? So just ask all of the details ahead of time for that. Will they do some light meal prep? While they're working with your person, could they also get something prepared and in the fridge so that you can just throw it in the oven for dinner? Will they do some light housework as well as working with your person? Will they deliver medications, and then also transportation? Will they take your person to a doctor's appointment, to the local senior center, to another activity? And then also, whose vehicle are they going to be traveling in? Check into hours. Is there a minimum requirement for hours in the day or hours in the week? And then is there flexibility in that as well? And then ask for any special concerns that you may have about your person. Again, we get back to you know them best. So will they accommodate if, for example, maybe you are caring for your mother and you know that she won't respond well to a male who is a shower aide. So ask, especially an agency, if they are able to accommodate if you have a male or female preference. Ask about spoken language. As someone progresses, if they had a first language that was different than the one that they speak now, they may convert back to that original language, or maybe they have never learned English, so are they able to accommodate a different spoken language? And then think about other individual concerns that are specific to your person. Now, to ensure success, again, we need to be mindful of how we communicate. So when you're communicating with your person, think about if you expect them to be resistant to in-home care. If you expect them to be resistant, don't tell them about it ahead of time. I had a caregiver who made the mistake of doing that, and that gave her plenty of time to get really upset about the caregiver coming, and she escalated so much and got so stressed out about it that they ended up canceling the appointment. So don't tell them until absolutely necessary that this is going to happen. Watch your nonverbals. What is your pitch? What is your tone? What is your posture saying? You really need to convey to them this is no big deal, or that this is even a really great thing that's about to happen for them. If you're not communicating that, if your nonverbals are saying, I'm really nervous about telling you this right now, I really hope this is okay with you, they're going to hear that and their radar is going to go up. And it's going to be that much harder to encourage them that this is really a good thing. Another strategy, blame someone else. And Banner is a great organization to blame. We take the blame for a lot of different things. So let them know that we said they have to have an in-home caregiver. You can also appeal to the almighty dollar if you think that would work for your person. Insurance is paying for it, so we might as well take advantage of it. Sometimes that'll really work for some individuals. Or another strategy, let them know this is help for you. So the person is coming to help me, they're not coming to help you. I need some assistance in this situation. Now when you communicate with an in-home caregiver, really do let them know who your person is as an individual. Let them know about their preferences, their likes, their dislikes, also their activity level. I knew one family who didn't realize this would ever be an issue, but the gentleman with dementia had a favorite coffee mug. And the in-home caregiver went and got herself a cup of coffee in his favorite coffee mug. And for him, that was the end of that in-home caregiver, and they needed to ultimately bring in a different caregiver because he was so upset that she used his coffee mug. So let them know things like that. Avoid the Penn State coffee mug because that's his favorite and that's his. And then also let them know your messaging to your person so that they can reinforce that. So if you said insurance is covering this, your person may well check with the in-home care agency. So this is being covered, right? Let them know what you've told your person so that they can reinforce that for you. Some tips that we can remember, first of all, know that you are the employer in this situation. They work for you, and you don't have to hire the first person that you talk to. Also have expectations when they're coming into your home. Prepare an activity list, prepare a chore list, and be present for the first few visits to just observe how things are going, or to maybe even offer those tips and step in as they're pouring coffee into the Penn State mug to tell them, no, don't do that. Now another option for someone help maintaining connections for your person is adult day health centers. And adult day health centers provide a safe setting for the person with dementia. They are filled with activities that are structured and designed for your person to feel success. They also give your person the opportunity to be with other individuals. It can help improve their mood and engagement in activities, and this allows you time to then take a break. When you're trying to find the right fit for an adult day center, think about, do they have specialized care for people with memory impairment? Also take a look at their list of activities. Are there things that your person is going to actually be interested in? You know, some adult day centers have a focus on activities for men. So they'll do things like woodworking and those sorts of things that are more stereotypically enjoyed by males. So looking to see, are there things that would interest your person? Can they assist with toileting or bathing or medications? Look into the fees and the charges that are charged as well. Are there going to be extra charges for incidental things that can happen throughout the day, or extra charges for different activities? You also want to know what their operating hours are, and does that fit with your schedule? And then lastly, check and see if they have transportation. Many adult day centers do offer the ability to pick up and drop off your person within a certain radius of the facility. To ensure success, think about how you're communicating, again, with your person if resistance is expected. So first, engage them rather than ask them. Rather than saying, do you want to go to the adult day center, engaging them in that activity is probably going to be a lot easier. Go ahead and stick with them on the first day too, and this will give you a chance to experience what a day there is like. Talk positively about the activities and the other people that are around. See if you can set up social interactions with your person on that day that you're kind of shadowing. Think about how you're going to present this to your person. I don't know many of us who would respond positively to, do you want to go to the daycare center today? So think about how you're phrasing this. Is this part of their therapy? Are they going to the new social club that has opened up? Maybe they're going there to volunteer and help out some of the other patients who are there. Maybe they're coming to work. I knew a family who told the person with dementia they were going to work every day. They had this rotating $20 bill where the wife would kind of sneak it behind the scenes to the day center. He would work all day long. At the end of the day, they would say, great job, a full day of work, and hand him this 20. And he would get in the car and say, guess what, it's payday, and hand it back to her. And the next day, the same thing happened again. So think about what story will work best for your person. With the center, it's going to be very similar to how you're communicating with the in-home care. Let them know who your person is. What do they like? What do they dislike? What are their preferences? Discuss with them any mood or behavior problems that you have had as well. And then finally, let them know what you've told the person. Are they going to work every day? Are they volunteering? Because the day center will be able to reinforce that message. Some tips. First of all, don't always trust your person's feedback. Ask the staff about participation and interactions. Many times you can pull up at the end of the day, your person gets in the car and you say, how was your day? And they'll say, terrible. We didn't do anything today. And you go back and talk to the staff and maybe they've taken pictures or something like that, and you see in actuality your person had a blast all day long. So ask other people about how your person is doing there as well. Pick some consistent days to keep your routine going. Know that it may take several visits to become comfortable with this new setting for both of you. I find a lot of times that caregivers are the ones who offer the most resistance to starting their person in an adult day center. Really do give it a good try. Let them visit a few times a week for a few weeks. And more often than not, people do really settle in and start to enjoy it. Really consider choosing a day center that is close to your home just for the ease of transportation. And also know that there are programs that are part of assisted livings, continuing care retirement communities. This can get your person comfortable with going to this facility so that if a move is in their future, they already know some of the people there, the staff know them really well already, and it just becomes an easier transition. Finally, I would like to mention where you can find help. I think probably the best way to get good, sound advice is through word of mouth. If you have not engaged in a support group already, I would really strongly encourage you to get involved in one. This will give you an outlet to discuss any concerns that you have, and this is a great way to get reviews of different services that are out there and hear about other people's experiences with them. Another option would be to contact your local area agency on aging, which you will find those in every community across the country. And then finally, the Alzheimer's Association has a 24/7 helpline, and you can see the number listed on there. They can help guide you towards resources and let you know what services are available in your area. So now that I've shared all of this information, I would love to know if anybody has any questions or needs any further information from me. So I'll turn it back over to Lori at this point. So I'm not sure, maybe something has happened to Lori that we're not able to communicate with her at this point. So I really did talk most of the hour though. I would love to invite all of you to join us next month. Our dialogues now move on to talking about advanced stage dementia. So please do register to join us on October 19th from 12 noon to 1 p.m. when we're talking about advanced dementia, and we're going to really take a deep dive into what specifically is late-stage Alzheimer's disease. And you can register on our website, and you can see the address listed there. So thank you, everyone, for joining us this afternoon. If you did submit text questions, we will take time to address those after the fact and get back with you. Thank you for taking a break with us this afternoon. I hope you received some valuable information, and I look forward to joining you again in the future. Thanks for joining Dementia Dialogues, where we bring the dementia education to you.